Healthcare's mission is human. Better outcomes, supported staff, and sustainable systems. In this module, we'll show how AI powers clinical insights, research, and operational excellence, integrating securely with EHR and imaging systems through Microsoft's trusted healthcare ecosystem. In healthcare, the goals are universal, and they set the foundation for every AI use case. First, the goals. At the heart of it all is patient health and well-being, delivering safe, effective, and high-quality care. We want to build a supportive, diverse, and empowered workforce where AI reduces burnout, streamlines routine tasks, and lets clinicians focus on what matters most, which of course is their patients. Another key objective is to bring care closer to home, expanding access through telehealth and remote monitoring. And of course, protecting patient data and maintaining compliance is non-negotiable. Privacy and security must guide every step of AI adoption in healthcare. But the challenges are significant. Managing and governing healthcare data is complex. It has to be clean, consistent, and fully compliant with very little margin for error. Infrastructure is another barrier. Many organizations lack AI systems and data pipelines specifically for healthcare use. And finally, model validation. Every AI model needs expert review and continuous testing to ensure accuracy, fairness, and safety, because in healthcare, trust is everything. So, AI can create powerful opportunities across life sciences and healthcare. First, in reducing R&D costs. AI can quickly extract insights from thousands of research papers, data sets, and this is super helpful for scientists. They can summarize and analyze complex findings in minutes. Generative AI tools like Azure OpenAI services make it easy to query research in plain language, accelerating discovery and lowering the costs of deployment and development. Next is facilitating better drug trials. Machine learning is especially useful here. It helps to design smarter, more adaptive trials using all of the past data. It can combine information from wearables, sensors, electronic health records to monitor results in real time while automating data analysis to reveal trends that traditional methods might miss. Third is optimizing supply chains. AI keeps track of temperature-sensitive medications in storage and transit, predicting demand to reduce waste and prevent shortages, and ensuring patients get what they need when they need it. And finally, the acceleration of time to market. AI speeds up every stage, from identifying promising compounds to recruiting the right patients for trials. That means that approvals, lower costs, and life-saving treatments are reaching people sooner. Now, we've talked about these opportunities. I now want to talk about how these ideas are already taking shape across the industry. Here's a couple of things that we're seeing. First, AI research assistants. These tools are transforming how scientists explore information. So instead of spending weeks combing through papers, researchers can now ask natural language questions and instantly uncover trends across thousands of studies. In oncology, for example, AI assistants can surface emerging treatment pathways or promising gene targets within hours. Drug development is another exciting opportunity. Generative AI is accelerating discovery by analyzing molecular structures and predicting which compounds are most likely to succeed. So this means much faster early-stage research, fewer failed trials, and more time for scientists to focus on breakthroughs. And finally, team communication. AI-powered virtual assistants help bridge the gap between the different disciplines. So they can translate clinical findings, summarize reports, and keep cross-functional teams aligned in real time. Imagine an AI tool that translates a radiologist's insights into plain language for the rest of the care team so that clarity is there when it matters most. At the core of what we provide at Microsoft is an ecosystem that is built for one thing: seamless, secure integration of medical data across systems and providers. Azure Health Data Service is the backbone of this. It connects electronic health records and medical imaging data into the Azure ecosystem, following the industry standards like FHIR and DICOM, or DICOM. That means that AI can now analyze patient histories, identify risk factors, and even predict chronic conditions. This can help providers intervene before issues escalate. And that same data can flow directly into Microsoft Teams, where clinicians collaborate and document care even more effectively. When it comes to imaging, AI integrated with DICOM data helps radiologists detect anomalies faster and with greater accuracy, while improving diagnostics and outcomes and reducing overall workload. All of this runs within the Microsoft Cloud for Healthcare, bringing together Azure, Dynamics 365, and Microsoft 365, and protecting patient privacy and delivering a trusted foundation for AI innovation. And from there, that can manifest itself across several areas. First, in productivity. Microsoft 365, Copilot, Dynamics, Power BI, and Teams help clinicians create reports, summarize meetings, and free up time so they can focus on patient care. Then we have our contextual interactions. This enables personalized treatment recommendations, intelligent virtual assistants for both patients and staff, and even onboarding tools that guide doctors through protocols and procedures. With automation, AI can organize medical data, predict patient volumes or the equipment needs, and even generate full circle reports on outcomes and performance, all automatically. And finally, intuitive discovery. With AI, providers can mine patient feedback, research, and health trends for insights. So for example, claims teams can summarize cases, detect fraud, or even draft appeals automatically, which I know will save so many people so much time. Doctors can stay current on research, enhance diagnoses with AI-assisted imaging, and even use contact center analytics to better understand patient sentiment and satisfaction. So in short, Microsoft's healthcare AI ecosystem, it's not here to replace clinicians. What we want to do is empower them. We want to connect data, people, and insights across every layer, making medicine not just smarter, but more human. We are honored that several healthcare institutions have worked with us, and I'd like to share one of their stories. Zimmer Biomet is a healthcare technology company that develops medical devices. Their solutions serve orthopedic patients and the healthcare professionals treating them. They aim to alleviate pain and improve quality of life before, during, and after orthopedic surgeries. Innovation is key to reach this goal. Using Microsoft Azure AI technologies, Zimmer Biomet developed My Mobility, a patient engagement app. Now, this enables patients who have had a hip or knee replacement to better understand how they are recovering. The data gathered by My Mobility is fed to an AI system named Walk AI, which contextualizes a patient's gait recovery with other patient data. 90 days after a knee or hip replacement, the AI can confirm whether a patient is on the right track or whether they should receive a bit more attention. Mark Brincat is the Senior Director of AI and Advanced Analytics for Zimmer Biomet. He told us, "It's all about the data now. To have any chance of building something that is sustainable, you must have an AI strategy. Establishing the right digital foundation, particularly in a healthcare setting, is key to success. We have enough data to get more personalized and predictive and to start to move away from a very reactive market. Instead of just checking in with patients at 6 and 12 weeks to see how they're doing, surgeons can add digital monitoring to their care plan and be more targeted in their interventions." Michael Griffiths is the Engineering Associate Director for Machine Learning at Zimmer Biomet. He adds this: "We carried out a thorough process, talking to companies and working out what approach we wanted to take. We had the freedom to decide which cloud provider we were going to use, and we saw that Microsoft was a good fit all around. Azure Kubernetes Service helps us to have a scalable platform. We can add data from products into it, and that environment will meet the resource needs because it's backed by the Azure-provided infrastructure. We're really keen to make sure that what we build is scalable and flexible for all the different types of products that we are deploying, now and in the future. Microsoft is there, making sure that the underlying infrastructure is up and running all of the time. Associate Director of Data Science, Carl Zermax, shared this. We wanted our products to include clear explanations. When our models offer a prediction to a clinician, they also provide the reasons behind that prediction. The data can really contextualize a patient's gait recovery, either to reassure them that they are on track or to encourage them to be a bit more active. And finally, the president and CEO, Ivan Tornos, had this to share. With Walk AI, we've created the first AI-based predictive analytics model in orthopedics. We have a relentless focus on investing in innovation that will enable our customers to deliver best-in-class care for the patients they serve, and breakthrough technologies like Walk AI help move our mission forward. AI is helping healthcare professionals spend more time with patients, uncover insights faster, and deliver care with greater accuracy and empathy. By connecting secure data with intelligent tools, your organization can advance innovation while protecting privacy and trust. Thank you for completing Microsoft AI for Business Leaders. You're now ready to guide meaningful change in healthcare with AI. We encourage you to learn more about this course or search out your next favorite topic on Microsoft Learn at aka.ms/learn.